Whether you get a vaccine when the time comes might not be up to you. It could be your employer making that call.
This week, the EEOC issued guidance saying that employers can require it. Amanda Quintana is outside SSM Health St. Mary's Hospital with the details. Amanda?
Yes, well, right now it is still just those frontline workers that are getting the vaccine here at SSM Health, UW Health, and Meritor. They're all saying that it is not a requirement, but it is, of course, the frontline healthcare workers do want to get the vaccine. A lot of them do want to get it. It's voluntary. But now in the spring, when it becomes available to the general public, it'll be up to other employers to decide if they want to make it mandatory for them.
Just based on my long-time experience with Dane County and Madison employers, I do anticipate a lot of Madison employers requiring vaccination to return.
Employment attorney Nick Fairweather is preparing for what he imagines will be a large number of calls over the spring and summer, as some employers make it mandatory that their workers get a COVID-19 vaccine.
I do see a pretty big potential significant potential for employees to have disputes with employers and, in situations that could potentially end a job and have a pretty significant impact on an individual's career.
Similarly to how many protested mask mandates, Fairweather thinks tension could arise here too. The two biggest exceptions would be for those with certain disabilities or religious objections. Federal guidance says employers would need to make accommodations for these employees, such as moving them to an area with fewer customers or requiring them to wear a mask. But if they still pose a threat, they can be fired.
In many ways, it's much easier for an employer to simply say, I'm going to encourage it. I'm going to strongly recommend it. I'm going to make it easy for you.
UW-Madison law and bioethics professor Alta Sharo thinks most businesses will take this route, maybe even incentivizing getting the vaccine with perks like first-to-pick vacation days.
It helps you avoid the kind of emotional resentment at being told what to do that leads even reasonable people to sometimes say no.
She says although voluntary compliance has worked in public health in the past, many times even better than mandates, this pandemic is an example of the political divide making it much harder. Still, her advice?
Wait until you've seen that voluntary doesn't work before you contemplate the pros and cons of trying to make this mandatory.
Sharo says employers have some time to learn about the law and to decide if they want to make it mandatory. They can also learn from the health systems like SSM Health that are making it voluntary, so they'll see how many of their employees actually decide to get the vaccine.
Amanda Quintana reporting outside St. Mary's. Amanda, thank you.